Welcome back to Highs and Healing, Nurse to Nurse Conversations on Cannabis and Psychedelics. This is episode 4, and today we're talking about cannabis and pain. We have a lot to talk about today. All right.
Oh, yes.
Ariane, what is your experience with cannabis and pain?
Oh, goodness. Well, interesting enough, like cannabis and pain is what really got me started on my journey with helping people medically. My dad has chronic pain. He also has a history of opiate use disorder, and I have consent to share his story. I share it a lot. And he came to me one day and decided that he didn't want to be on pain management anymore because the cannabis that he was utilizing was helping. And he was continuously getting drug screened for THC at his pain management clinic for these medicines that really weren't serving him anymore. So because of that, I took it upon myself to start doing some education and help him wean off of opioids and get to a place to where he could be managed with different types or different applications of cannabis. So that's my knowledge around it. It's like personal experience with my dad. I've also used cannabis to help myself recover after surgery. I've used it to help with menstrual pain. I've used it to help with headaches and colitis flare-ups when I've had it in the past. So yeah, I have a lot of personal experience. I've helped family. I've helped other people manage their pain.
Okay, let's talk about why cannabis works for pain. And I think it's really important to talk about like the difference between opioids and cannabis when it comes to pain. Yeah. And opioids work by like just blocking the pain signals that go to the brain. It doesn't block the source of the pain, it just blocks the signals. And it's really easy to develop a tolerance to that. And then it's no longer as effective. Whereas cannabis actually works by kind of going after the source of the pain, which is a lot of times inflammation, and what else? What are other ways that cannabis and CBD help with pain?
Yeah, well, I mean, in a way, not like opioids because it's a different part of the pain pathway. There's multiple pain pathways, one of them being the glutamate and the GABA pathway. And cannabis, specifically with THC, I think, yes, cannabis specifically with THC has been known to interrupt the signaling of that pain pathway. The difference between cannabis and cannabis and opioids when it comes to pain, in my personal opinion, is the breakdown on the body and how difficult it is for the body to process, right? So it's not actually supplementing, it's not helping anything, it's not decreasing inflammation. Cannabis is working in multiple ways. So not only is it like working on that pain pathway, it's working on the inflammation pathway. It's working on our neurotransmitters and the way that we're perceiving our pain. Right. So it's working in a multitude of ways where opioids really are just essentially numbing you out, putting a Band-Aid on things. They're causing GI issues. They cause neurological issues. They interrupt your life and can decrease quality of life. Right. So that's one of the big things that are different. Right.
Right. Yeah, definitely. Okay. So let's talk about what we do when patients come to us with pain issues. My first thought for a lot of types of pain, of course, not every type of pain is the same and should be treated the same.
Right.
With chronic achy type pain, I prefer to get our patients started off on our relief, which is high CBD, low THC. Not enough to impair people or get them high, but enough to help the CBD to work better. And then pain-targeted terpenes, beta-caryophyllene and humulene, which help with inflammation that causes the pain. And a lot of patients really like this is our first, usually our first line, unless it's like an autoimmune type pain. And then I prefer to use something like THCA for autoimmune type pain to help with that related inflammation.
Yeah. There's a lot of research around the acid forms of the cannabinoids. I feel that it's starting to come out, especially with inflammation, including chronic pain. CBDA, THCA, be helpful for chronic pain. And that's including like the achy joints, right? Or arthritis. This is also some of your neuropathic type pains and stuff like that.
Right.
When it, yeah, you know, and also I think one of the things like that we talk about with a lot of people is how it can be a multi-step approach, you know, and it's multi-application, and it's not just this one thing, right? It's going to be a bunch of different things that we can use in combination and kind of tailor to you.
Right, right. And I think that's where like a topical can be really, really beneficial for people suffering from pain as well. And you know, we have two different topicals. One is CBD plus CBG plus beta caryophyllene, and then the other one is CBD and CBDV and THCV. And I've been reading that topical THCV can help with nerve pain. Because it just kind of has like this amazing nerve dampening effect. So I tell patients that like it's when, you know, when we're treating pain, it's really important to like treat pain from the inside out with something like a tincture, and then from the outside in with something like a topical multimodality treatment. What are your thoughts?
Yeah, no, the same, you know, I mean, and with the people, you know, that I've worked with pain, whether that be autoimmune, whether that be chronic or neuropathy type pains and stuff like that. I mean, it is a multi-application approach, you know, and it sometimes for some people, it looks like vaping or inhalation along with edibles, because the edibles, like you get that instant relief from the inhalation method, and then you have the extended release from the edibles. So depending on metabolism, they're kicking in around the time that, you know, maybe that vape is coming down, that inhalation method. And then you throw a topical on top of it for like breakthrough and stuff that happens. Or, you know, my dad, he liked using the topical every night before he goes to bed. He puts it on his feet, puts it on his neck, and he puts it on every morning. And my dad has severe nerve damage in both of his feet. And he uses a CBD, topical that we provide through Trusted Canna. And it's one of the things that gives him the most relief with things, especially at night. Honestly, it's like it helps him get the relief through the night because it's the topical, it's absorbing. He uses edibles as well, primarily at night or when he has something that's going to be a little bit more wear and tear on his body. So it's something that lasts a little bit longer, you know, and it's really kind of figuring out the things that work for you, and when it's supportive and how can it be supportive. And I can appreciate that this seems like really challenging, but it's truly not. It's not.
Right. Yeah. And it is trial and error. You know, the same thing isn't going to work for the same, you know, for different people. It's trial and error, and it takes time. You know, I had a patient come to me, her doctor had taken her off of all of her pain meds. She didn't want opioids and she was on an anti-inflammatory. He took her off of that because of her risk of bleeding and then didn't give her anything. So we started her on relief, and she wasn't happy because it took a while, but then she gave it a few weeks and now she's taking it consistently. And, you know, she's on her third or fourth month and her pain is much better managed. So it does take weeks of consistent dosing oftentimes to bring down the inflammation related to the pain.
Right. 100%.
And to like change the perception of the pain. It's not going to take away all of every single pain or all types of pain, but it can help change the perception of pain. And what does that mean to you to change the perception of pain?
Great question. So changing the perception of pain for me means changing the relationship with pain, right? Something that is more of acceptance and something that is less of like fighting against it. And, you know, there's a lot of different ways of doing that. Doing body scan meditations can be really helpful, especially in combination with cannabis. When you can relax your body, you can get into your body, you can breathe into those spaces that are really tight with that pain, and you can allow yourself to just exist. You can take some of that fire off of it, right? You can take some of the charge off of that pain and create a different relationship with it. Because I mean, to be realistic, right? This is to increase quality of life. And sometimes that looks like being able just to live with what we have in a place of acceptance.
Right.
And I think cannabis is a beautiful tool for that.
Yeah. And it can also like decrease the anxiety around the pain also.
Right.
I think that helps to change the perception.
Yeah.
And, it's so important for people who like, it's so important for them to have medical guidance and walking through this so that patients don't like waste their money on crap products, so let us help you find the best products that can actually work to manage your pain. We're not gonna give you a CBD isolate because that's not evidence-based for being effective. And we are going to also suggest other amazing supplements that can help with pain and inflammation as well.
Yeah, I mean, we definitely take an approach from more of a holistic standpoint. I think that whenever we're working with pain, because it's a mind, body, spirit, like that really is like, instead of just looking at one thing. And that's what cannabis medicine is it's mind, body, spirit medicine, right? Yeah. One thing I will say and touch on, and I know that we're like running short on time, is that like, when it comes to pain and it comes to opioid use in states that are legal, there is a decrease in the amount of opioids that are written, prescribed. Opioid abuse is decreasing. The amount of overdoses and death are decreasing in these states. There is a pain management physician in North Carolina, and I think that at the time of him speaking on it, I don't think that they have legal THC or medical program for that. I think it's primarily just CBD and following the farm bill, and they saw a significant decrease in the amount of opioids they were prescribing whenever they started initiating CBD whole plant therapy in their clinic. And I think that speaks volumes on the things that can happen. Having the support, having someone to guide you along the way, to answer your questions, to reinforce like that you can create a different relationship and really get empowered with the way that you treat yourself and your pain. It's really beneficial for getting sustainable results and like taking your power back from the system that's been created with pharmaceuticals.
Yes. I love that. Yeah. Mind, body, soul. Thank you so much for watching. We will see you next time on Highs and Healing, Nurse to Nurse Conversations on Cannabis and Psychedelics.